when you've dealt with teenage athletes, who the majority of our listeners are going to be teenage athletes, high school athletes. What is that kind of process of like for you, as far as just explaining that injury to them, and just kind of getting them mentally prepared for the road that they're going to face if they want to get back to their sport?
Good question. I think part of it is just understanding what the injury is, and then talking about what we can do to get them treated. That involves a surgery. It involves usually taking a piece of their own tissue, typically the patella tendon tissue, to rebuild their ACL. It's done as an outpatient procedure, so you go home after surgery. You begin rehabbing pretty much right away. You do need to understand that it takes time. It takes time first to get your range of motion back, which usually takes a few weeks. Then it takes a couple of months to start getting the strength back. The goal is usually around between 3 and 4 months for people to start running. Usually people are, some of the anxiety gets resolved a little bit when they hear 3 months and 4 months, because it's that sometimes people think you're just incapacitated for an entire year.
Right.
That's not the case. The one goal is around 3 to 4 months is when we start getting people jogging and starting to get their muscle back and their function back. So that's one threshold right there. Around 6 months, you can get a little bit more intensive in terms of your rehab, with the goal at about 1 year. If everything is progressing well, there aren't any setbacks, they're meeting their goals. Around 1 year is about when we shoot for getting athletes back on the court, on the field or the court. Now, could you try to get it back sooner? Could you try to get back at 6 months? Yes, you can. 6 months is a very accelerated rehab program. People have been shown to have increased risk of re-injury when they go back at 6 months. So we have learned over the years that if we shoot for 6 months, it's with a risk of higher risk for re-injury. If we shoot for 1 year, then the risk is lower. And then there's people in between, someone whose sport starts at 9 months. So we shoot for 9 months, understanding that they're not maybe as low risk as someone who waited a little bit longer. But it's not just time. It's about the work that's put in. It's about how conditioned they are, how strong they are, how they've demonstrated how functional they are to the therapist. So it's a team. It's a holistic approach. It's a holistic process with multiple people involved helping make the decision: the therapist, the doctor, and the patient.
So you mentioned that there's a variety of, depending on the timeline, there is a greater risk. Just in general, is there not a greater risk for those who have already torn an ACL to tear it as opposed to someone who hasn't? And if so, how do you change the prevention methods for those who have already torn it and they don't want to tear it again?
Yeah, I think it kind of goes back to what we talked about in terms of not rushing back.
Right.
Making sure you're ready, and then implementing the prevention protocols and rehabilitation that we would do for someone who's never torn their ACL. We apply those same things to the individual who injured their ACL. Now, some of the things that we've learned is that people who tear their ACL are even a little bit higher risk of injuring the other knee.
Okay.
So that's why it's so important to have the confidence to be able to use your knees and get back with confidence so that you're not compensating and putting more pressure on the other knee.